I'm Melvin Cauthen. I'm the administrator of HIV STI Services for Montgomery County, Maryland. I have been working for the county for 12 years. I started as a medical case manager and then the supervisor of the medical case management unit. And then I moved into the administrator role about almost a year and a half ago. So this is relatively new for me. And as I came in and took the role, we started ending the HIV epidemic initiative. And so I've kind of hit the ground running. And here we are a year and a half later. The HIV, ending the HIV Epidemic Initiative is a federally funded initiative. Uh, it is based on, it's called a phase one approach. There are 47 counties plus DC and Puerto Rico that were identified where altogether account for more than half of the new HIV infections. That was over a period of 2016 and 2017. So the federal government has given us a ton of money and a ton of goals and a ton of responsibilities to come up with a plan to address HIV infection in Montgomery County. In addition to Montgomery County, DC and Prince George's County and Baltimore City, our neighbors, are also part of this initiative. So as we are all have individual plans, but since our population is transient, they play, they work, they visit in all of the locations. It's really important, and we have been, that we as partners work together to make sure that we're kind of shoring up whatever we can do to attack this together. But all of the plans are individual. So the plans that we created are addressing the needs for Montgomery County. And a lot of the things in our plan that we've done is, I'll call them scaffolding kinds of things, of getting the county ready for the kind of things that we want to do. So the plan has four main pillars. It is diagnose, treat, prevent, and respond. And I can kind of go through them. That diagnose pillar is testing, getting folks diagnosed. It is believed that there's a large chunk of people that don't know their status, so getting those folks tested. Now, the health department can only do so much testing, so it's going to be really important during this phase is that we get as many private physicians, as many primary care physicians, as many ERs. If we could get routine testing to be the norm or to be the rule in Maryland, we would, in a sense, have a blanket where very few folks going out for medical care would be missed. The next phase is treat, getting those folks who are diagnosed into care as soon as possible. That's called direct care. If we saw it kind of as it's a red alert, anyone who tests positive for HIV in Montgomery County, if everyone who is there looks at that as a red alert, to get them into care, to get them resources that they need, because a lot of folks need other resources other than HIV to help them, then that would be perfect. Also, there's data to care. We get lists from the state of folks who've fallen out of care or folks who haven't had lab results in a certain period. We use that data to then reach out to those folks and get them back into care. So that two-prong approach of getting newly diagnosed folks plus folks who may have fallen out of care back into care is what we're looking at. The third pillar is prevent. If we can prevent people from becoming HIV positive, then again, we don't have to look at diagnose, we don't have to look at treat. And so one of the main tools in that pillar is PrEP, the pre-exposure prophylaxis. If we can get as many folks who are in a high population categories, a lot of our LGBTQ population fits in that category. If we can get those folks screened, if we can get them on PrEP, again, we are lessening the folks who will then eventually become HIV positive. So those are huge, huge, huge. Get the folks tested, get everybody into care, get the folks who can be on PrEP, access PrEP as soon as possible, and then respond using kind of data, using surveillance data, finding out where the hotspots are. If there are any clusters in the county where we're seeing a lot of positives coming, and then addressing those specific areas directly with resources, with needs, with the kind of attention that we can kind of hit it and address it directly, as opposed to allowing these hotspots to bubble up, to broaden, to get out of control. So that's kind of the gist of what we call in the epidemic EHE. So if I use that EHE term, that's what that means. So we call that the gist of our plan for EHE. Now, all of the jurisdictions are using the same 4 pillars, but they're going to look at them differently as we look at them. One of the other things that we're doing, we're looking at opening a satellite office in Germantown. Our main office in Silver Spring, a lot of the folks who are up county have to come down to Silver Spring for testing, for treatment. So we now know that there's a large active population. We're able to look at zip codes. We look to see who's coming to us for testing. We're able to see, for example, syphilis rates. We're able to see kind of what the needs are up county. So we said, let's open a satellite office where, one, we cut down on folks' travel. A lot of our population, they don't have medical leave, or leave to come and visit us. So a lot of those folks, when they're taking off to come in to be tested or come in for their appointments, they're not getting paid. So we said if we can kind of address those needs, and that's some of the barriers that we're talking about. And I'd like to talk about, just for a moment, for our location at Dennis Avenue. We have been there for over 30 years, serving the community in the same spot, same location, providing services. Just to talk about some of the services there that we do provide. We provide complete HIV testing and treatment. We have a full dental clinic on staff. We have an STI clinic where there's testing for HIV, testing for STIs, and treatment as well. And we also have what we call client services. That's where there's case management, there's assessment for food insecurity, there's rental assistance, there's substance abuse, there's mental health counseling. So we look at ourselves as a one-stop shop. Anybody who comes through the doors, we can take care of you. So going back to what I mentioned before, as far as testing, as far as primary care physicians, as far as ER docs, if we can get those folks to test, and when someone becomes positive, they report it, and if they need be, they refer them to us. We are the resource. This is what we do. So, because I think that sometimes people may be leery of testing because they said, if somebody tests positive, then what do I do? I kind of stuck with them. Absolutely not. This is what we do. We are the experts. So the more that we can encourage medical providers and help make them feel comfortable to test, knowing that if someone tests positive, okay, I can call Dennis Avenue, I can call the folks there. They can tell them where to go, they can tell me how to help them, or they can treat them themselves. That's what we do. Pride in the Plaza. This is our second year. I do have a colleague here who's going to go into more depth, but just to kind of give just a little peek into Pride in the Plaza. Last year, COVID was ending, and so we got permission at the last minute. First, we got permission to have 100 folks, and it's down at Freedom Plaza in Silver Spring. We got permission to have 100 folks. The week that this was happening, they opened it up, so we got to have a much larger event. There is a ball that happens, a ball competition. I think we have 40 vendors this year. This year, the biggest difference is, I was heavily involved last year. This year, I kind of turned it over because it got bigger than me, that we have about 40 vendors coming, 40 tables with information, and it's going to be a week-long affair that's starting that Tuesday, the 21st, and culminating on Sunday, the 26th, on our big Pride celebration. We actually got to raise the Pride flag there, got permission for the whole month. Last year, we did it on the day. This year, we did it for the whole month. I believe it was like June 2nd that the county executive came down. We got to raise the flag right there. We took a couple of pictures. But what we're hoping is this becomes an annual event, an annual celebration, but more than just a celebration. It's an annual gathering where information is exchanged, where resources are exchanged, where providers and vendors get to know each other and know where to go to kind of for services, for help. That's kind of our big goal, not just a party, but actually it's a sexual health and wellness event. And one of the things that we've started along with this, going back to EHE, is that there's certain things that we've done already. We started the county's first sexual health and wellness campaign. It's Do It For You. Anyone out there may have seen it on the buses. We did get some emails, but we thought it was really important when Dr. Gales was here He said that our plan is bold, and so are we. So we took a very bold approach because we wanted to get the message out. We wanted to get the message out that HIV is still here, that people are still being infected every day, and we wanted to educate. Wanted to educate and also provide resources. So we're also on social media. We're working on some television spots. We shot a PSA. There are things that we're looking. The EHE plan is multi-year. The goals of the EHE plan is to reduce HIV in the county by 75% by 2025 and by 90% by 2030. In order to do that, we're going to have to be really aggressive. As I said before, in order to get ready for that, we needed to get our infrastructure ready. We didn't have the staff to do it. There's certain things that we didn't have. We didn't have enough testers. We now boosted our testing force as well, as we're now engaging with other partners who can also test. So that's what we're looking, not necessarily that the health department is going to do all the work, but that the health department is going to be a partner in the work that we do. We're going to be reaching out to primary care physicians. We're going to be reaching out to all the folks who can help us get more testing done, get more treatment done, identifying those folks who are HIV providers, so that we then develop a network of testers, a network of providers, and of which we will be the center of that network, but not doing the whole thing ourselves. That's a really good question. Of course, the future, everybody's looking for a cure. That is what everybody's looking for. But what we're looking to do is to fill the gap. If we can lower the percentage of folks who are testing positive, that's what we're looking at now. What can we do now? While a cure is in development, while folks are working on that, we're looking at today of what we can do. And the medications are getting better every single day. Looking at, well, I mentioned PrEP, the medication that keeps people from becoming positive. There's now an injectable PrEP that instead of folks having to take a pill every day, they may get a shot every other month. And so those advances are happening even as we speak. So there's also, I guess, the shot routine on the treatment side as well, that instead of taking medication every day, there are now medications available in shot form that folks can take once a month. So we at the health department are starting to branch out into offering those to patients who kind of fit the profile. People who are take the pills every day are going to be the best candidates for those. But I think that what we've seen in the few people we have offered these medications to, people actually like the fact that they don't have to think about medicine every day. I'll come in and get my shot, and I don't have to think about it. I don't have to think about who I hide my pills from. And so that's where we see some of the major benefits. So that's kind of where we're moving. In my opinion, this movement is going through prevention. We've got treatment down. We've got treatment down. We see kind of the advances that are happening in treatment. Prevention is going to be, again, that's my opinion, to be where the next big focus is happening, preventing people from becoming HIV positive. And so part of those treatments, we talked about PrEP, is going to play a big role. Condoms are still around because the PrEP medication can prevent HIV, but STIs are still happening. And so, again, that's I guess a side, I guess we say a side problem, but I think it's not I don't want to call it a problem, because problem sounds like a negative. So it's something else that we have to address, because we're saying, folks, U equals U. Undetectable is untransmittable, meaning that if you're HIV positive, you take your medicines, the amount of the virus in your blood is low enough that it's undetectable. You can't pass it on. That is the biggest message we have. But U equals U doesn't prevent STIs. So we want to make sure that folks are being tested, and when they do test positive, that they're being treated. We are very sex positive. We're in sex positive, we're in the sex game. We want to make sure that people feel free to live their lives, feel open to live their lives. I think that years ago, back in my earlier days, it was about just say no. It was about being abstinent. Absolutely not. Absolutely not. We want people to live their lives. We want people to live their lives to the fullest. We just want, in a sense, to be part of that, give them the education, give them the resources that they need to keep themselves healthy while they're doing that. So the funds that we're getting are going right into programming, meaning that it's going right into boosting our staff, going right into helping us develop new parts of our program. This is how I look at it. That I said we've been here for 30 years, and we've kind of we've done a great job in that 30 years, but we haven't had the resources to kind of move forward. I look at it this way. We have a short period of time to do all of the things we've wanted to do, to make all of the changes, all of the expansions we've wanted to make so that our program is more modern, it's more robust, and it's actually meeting the needs of the people today. It was a different program 30 years ago. 30 years ago was about survival. Today it's about living. And so we want to make sure that we are there and we're meeting the needs, not today. And we're not meeting the needs on our terms. We don't want to be a health department that tells people of how to live and how to do things. We want to respond to how they're telling us how they want to live and what they need. So that's why we've changed our testing form. We've opened our testing form up for HIV. It's not just about testing someone HIV finger prick and out the door. It's now we've included questions, and of course this has been CDC mandated. We've included questions about, do you have enough food? Do you have enough money to pay your rent? Do you have any other issues that might need to be addressed? Because I'm a social worker by trade, and kind of what I know and my training is, if folks have other needs, their medical care, their testing may not be at the top of the list. So we want to make sure that there are no barriers that folks may have. I mentioned the other, opening the other location in Germantown. Potentially, traveling to Silver Spring for a lot of folks was a barrier. So if we can lessen that and we can kind of bring us closer to them, I believe there'll be more folks who actually will engage and use our services. I don't believe that people, in a sense, don't come because they don't want to come. It may not be convenient, and we got to make sure that we're listening and that we hear that and that we respond. I will be at Veterans Plaza on the 26th. I'll go to as many events during the week as I can. But it's funny that you mentioned how am I celebrating Pride. Last year, it was a big event. I did my nails. I want to celebrate. I'm an old guy, but I want to celebrate. I want to be colorful like everybody else. I'm going to do them differently this year. I had like some press-on stickers. Didn't work. Anybody out there who who knows that didn't work this year? I'm painting them because I mean I think it's pride for everybody. I am a gay African American man, and pride is really important for me. It's important that I'm visible. It's important that our community knows who's visible, who's representing. So this is not about me, but I believe that if folks see me and they see me out, then it's like, yeah, it's okay to be out because the younger folks today are out. And so I'm going to join them. I'm going to go and have a great time, and I'll be there and I'll be celebrating. So thank you for asking how I'm going to celebrate Pride. You can find us if you look us up, Montgomery County, HIV, STI. You will find us, you'll find our services. We're on Facebook, we're on Twitter, we're on Instagram. Do it for you. That's the name of our campaign. Do it for you. You look up Do It For You, you'll find us.